Hey everyone, and welcome back to the channel. Today we're going to be talking about a medication called gabapentin. Now, you might have heard of it, or maybe your doctor has even mentioned it to you. Interestingly, gabapentin actually has a bit of a history. It was first cooked up way back in the 1970s, and its original purpose was to help people who experience seizures, like those who have epilepsy. Now, when we look at its official approvals, things get a little different depending on where you are. Here in Canada, it's primarily approved as an anti-epileptic medication, meaning it's officially recognized for treating seizures. But if we hop over to the United States, it has a specific approval for treating postherpetic neuralgia, which is a type of nerve pain that can linger after you've had shingles. However, and this is where it gets interesting, gabapentin is used quite a bit off-label for a whole range of other conditions. Off-label basically means that doctors are prescribing it for uses that haven't been officially approved by health authorities like Health Canada or the FDA. It's like using a screwdriver to open a paint can. It can work, but it's not what it was originally designed for, and there might be other tools that are better suited. So, what are some of these off-label uses? Well, doctors sometimes prescribe gabapentin for conditions like sciatica, that radiating leg pain, general neuropathic pain, nerve pain from various causes, fibromyalgia, a condition with widespread musculoskeletal pain, complex regional pain syndrome, CRPS, diabetic neuropathy, nerve damage from diabetes, anxiety disorders, insomnia, trouble sleeping, managing alcohol withdrawal symptoms, helping with smoking cessation, restless leg syndrome, and even those uncomfortable hot flashes that some people experience. Because gabapentin is used for so many different things, I often get a lot of questions about it. So, in this video, I'm going to tackle 10 of the most common questions people ask me about gabapentin. So, let's get right into it and talk all about gabapentin today. Question 1. How does gabapentin actually work? To really understand how gabapentin does its thing, we first need to take a quick peek at how seizures start in the brain. And you might be thinking, wait a minute, what do seizures have to do with pain? That's a great question, and the connection is quite fascinating. Our brains are incredibly complex networks, made up of around 100 billion nerve cells, or neurons. These neurons constantly communicate with each other by sending out electrical signals and releasing chemical messengers called neurotransmitters. This communication primarily happens at junctions called synapses. An electrical impulse travels down one neuron, triggers the release of neurotransmitters into the synapse, and these neurotransmitters then bind to receptors on the next neuron, passing the message along. It's a bit like a relay race with electrical batons and chemical handoffs. Now, in people who experience seizures, something goes a bit haywire. Certain groups of neurons start firing off electrical impulses spontaneously and excessively. These electrical surges can then spread from one area of the brain to another, kind of like a domino effect. This abnormal electrical activity in the brain is what causes the involuntary movements and other symptoms we commonly see during a seizure in someone with epilepsy. Gabapentin belongs to a class of medications known as anti-seizure drugs, anti-epileptics, or anticonvulsants. Its primary action is to calm down this excessive firing of neurons in the brain, essentially dampening the electrical storm and preventing or stopping a seizure. So, how does this relate to pain, especially nerve pain? Well, when a nerve gets injured, like when the sciatic nerve is compressed or when a nerve becomes inflamed, as in the case of shingles, it can also start to fire off electrical signals spontaneously. Think of it like a faulty wire, sending out random sparks. These abnormal signals are then interpreted by the brain as pain. Anticonvulsant medications like gabapentin can help to inhibit this spontaneous and excessive firing of injured nerves. By calming down the overactive nerves, gabapentin can help to reduce the frequency and intensity of the pain signals reaching the brain. It's like putting a muzzle on those overexcited nerves. But the story doesn't end there. Gabapentin also seems to interact with other receptors and substances in the brain. These include things like NMDA, glutamate receptors, neurexin-1 alpha, and thymopoietin. While the exact mechanisms are still being fully understood, it's believed that these interactions also contribute to gabapentin's ability to reduce painful sensations. It's a bit like it has multiple ways of influencing the pain pathways in the nervous system. Now it's important to look at what the research says about gabapentin for chronic pain. There have been several randomized controlled trials, and the Cochrane reviews are a great place to get a summary of the evidence. One Cochrane review, for example, showed that there's moderate quality evidence suggesting that oral gabapentin, at doses of 1,200 milligrams daily or more, can have a significant impact on pain for some individuals suffering from moderate to severe neuropathic pain that developed after shingles or due to diabetes. However, other reviews have shown more mixed or less promising results for different types of pain. For instance, one review showed conflicting results regarding pain relief for phantom limb pain and didn't find any significant improvement in function or sleep quality for those individuals. Another Cochrane review found very low-quality evidence regarding the benefits and potential harms of gabapentin for fibromyalgia. Similarly, a review looking at lumbar spinal stenosis with neurogenic claudication, leg pain when walking due to nerve compression in the lower back, found very low-quality evidence that gabapentin improved pain or walking distance. I actually have another video that goes into detail about spinal stenosis if you'd like to learn more about that condition. And finally, when it comes to migraines, the Alberta Guideline in Canada for managing headaches in adults recently updated its recommendations. Gabapentin is no longer recommended for either the prevention of episodic migraines, occasional migraines, or the prevention of chronic migraines, frequent migraines. This change reflects a reassessment of the evidence for its effectiveness in treating these types of headaches. If you'd like to delve deeper into any of this information, I've included a link in the description below where you can find the script of this video, and feel free to share it with anyone who might find it helpful. Question 2. What's the right dose of gabapentin for pain? This is a really common question, and the answer isn't always straightforward because the ideal dose can vary from person to person. Generally, when using gabapentin for pain, the goal is to take it 3 times a day, in the morning, afternoon, and evening, to maintain a consistent level of the medication in your system. To minimize potential side effects, I usually start patients on the lowest possible dose. A common starting point is 100 milligrams at night. The reason for starting at night is that one of the most common initial side effects of gabapentin is sleepiness. By taking the first dose at bedtime, you can often sleep through this initial drowsiness. Then, we gradually increase the dose. Typically, we might increase 1 dose each day until the person is taking it 3 times a day. After that, we might increase the total daily amount in weekly increments. For example, we might go from a total of 300 milligrams per day, 100 milligrams 3 times a day, to 600 milligrams per day, 200 milligrams 3 times a day after a week. The following week, we might increase to 900 milligrams per day, 300 milligrams 3 times a day, and then to 1,200 milligrams per day, 400 milligrams 3 times a day, the week after that. Once a person is taking 1,200 milligrams a day, divided into 3 doses of 400 milligrams each, we can start to really evaluate how well it's helping with their pain. If the pain has reduced by at least 30%, which is often considered a clinically significant improvement, and if the person is tolerating any side effects, we might continue with this dose of 1,200 milligrams a day. If the side effects are manageable, we might wait a few weeks to allow the body to fully adjust, and then consider further increasing the dose perhaps to 1,800 milligrams a day, 600 milligrams 3 times a day. In some cases, we might even need to go up to 2,700 milligrams a day, 900 milligrams 3 times a day, and rarely the maximum recommended dose is 3,600 milligrams a day, 1,200 milligrams 3 times a day. It's really important to understand that not everyone needs these higher doses. Many people find significant pain relief at the 1,200 milligram per day mark and don't require further increases. Question 8. Do I need to stop using alcohol if I'm prescribed gabapentin? The answer to this is a clear and emphatic yes. You should absolutely avoid or significantly limit your alcohol consumption if you are prescribed gabapentin. Both alcohol and gabapentin are central nervous system depressants, meaning they can slow down brain activity and have similar effects on the body. Combining them can significantly amplify these effects, leading to increased sleepiness, dizziness, and impaired coordination. More seriously, the combination of alcohol and gabapentin can also increase the risk of respiratory depression, where your breathing becomes dangerously slow or even stops. This can lead to overdose and potentially be fatal. It's a very dangerous combination that should be avoided at all costs. Always discuss your alcohol consumption with your doctor when you are prescribed gabapentin, and follow their advice to ensure your safety. Question 9. Is gabapentin good for anxiety and insomnia? As we discussed earlier, gabapentin is being used off-label for a variety of conditions, and anxiety and insomnia are among them. However, it's important to look at the evidence. Many of my patients who experience chronic pain also report having anxiety, and anxiety is characterized by unwarranted or excessive fear, often about vague or unknown situations. It can significantly impact a person's ability to concentrate and function in their daily life. While some doctors do prescribe gabapentin for anxiety, I haven't found strong evidence to support its widespread use for generalized anxiety disorder. There is a Cochrane review that showed moderate quality evidence of a clinical response in social anxiety disorder, but this is a specific type of anxiety and not the same as generalized anxiety. Similarly, while some people might experience sleepiness as a side effect of gabapentin, which could potentially lead to using it for insomnia, I haven't found robust scientific evidence to support its use as a primary treatment for sleep disorders. The sleepiness experienced as a side effect is not the same as promoting healthy and restful sleep. Question 10. Can people abuse gabapentin? Can you overdose and die from it? Unfortunately, the answer to this question is yes. While gabapentin is generally considered to have a lower potential for abuse compared to some other medications, it is a drug that can be misused. Some individuals may experience mild tranquilizing effects or even a sense of euphoria that's been described as being somewhat similar to the effects of cannabis. Addiction to gabapentin alone is considered relatively rare. However, people can develop withdrawal symptoms if they stop taking it abruptly, especially if they've been on higher doses for an extended period. These withdrawal symptoms can include anxiety, insomnia, nausea, sweating, and even seizures in some cases. Therefore, it's crucial to never stop taking gabapentin suddenly without consulting your doctor. They can help you taper off the medication safely to minimize any potential withdrawal effects. More concerning is the fact that gabapentin can indeed cause death, primarily by causing respiratory depression, where a person's breathing becomes dangerously slow or stops altogether. This risk is significantly higher when gabapentin is taken in combination with other central nervous system depressants, especially opioid medications. Opioids like codeine, morphine, oxycodone, hydromorphone, hydrocodone, and fentanyl all have the potential to slow down breathing, and when combined with gabapentin, this effect can be dangerously amplified. This is a critical reason why it's so important to tell your doctor about all the medications you are taking. It's also worth noting that the abuse of gabapentin seems to be increasing, particularly among individuals who also misuse opioids. Some people may take gabapentin to enhance the effects of opioids or to help manage opioid withdrawal symptoms, further increasing the risk of serious adverse events, including respiratory depression and death. So, while gabapentin can be a helpful medication when used as prescribed, it's essential to be aware of its potential for misuse and the serious risks associated with overdose, especially when combined with other sedating drugs. Always take gabapentin exactly as prescribed by your doctor, and never share it with anyone else. If you or someone you know is struggling with substance abuse, please reach out for help. There are resources available. If you found this video informative and helpful, please give it a thumbs up. It really helps others find this information. Don't forget to subscribe to this channel and turn on the notification bell so you'll be alerted whenever I post new videos on various health-related topics. You can check out the next video right here. Point 2 on-screen suggestion. I hope you find it interesting as well. Thank you so much for watching.